Recent data from the annual San Antonio Breast Cancer Symposium is shedding new light on a survivor's most nagging fear. Will my cancer come back? Dr. Tara Sanf from the Yale Cancer Center Survivorship Clinic is here to share study findings that redefine the 5-year survival milestone. Doctor, thank you so much for joining us.
Thank you for having me.
So why has this 5-year mark traditionally been important for breast cancer survivors?
Well, we know from our studies that treating breast cancer with anti-estrogen or anti-endocrine therapy for 5 years reduces the risk of recurrence. However, half of all recurrences happen after year 5, which has left us wondering, should we be treating patients longer than 5 years or not?
So tell us, how did the research presented in San Antonio affect the traditional notion of the 5-year survival benchmark?
Well, we learned about data from 3 large randomized trials last week at San Antonio. And what we found was that one size does not fit all. So women who took therapy beyond 5 years compared to those who didn't had a small but not statistically significant benefit, which leaves us in a place needing more information. We really need to understand which patients out of that large group benefit the most from long-term endocrine therapy. One way that we can do this is through the use of genomic tools, which is looking at the genes in a patient's cancer to give us information about recurrence. An example of a test is called the Breast Cancer Index test. This gives us reports about the risk of recurrence after 5 years, but also the likelihood that the pill therapy will prevent recurrence.
So what can a test like this do to help women make decisions about their health?
Well, this type of a test can really pick out the women who are at highest risk. We also heard about a study that looked at women with very small invasive breast cancers, the earliest stage of invasive breast cancer. Women who normally we would say at 5 years, your cancer is so small you can probably stop your treatment. A study that was reported last week showed that in that group, 30% had a high risk of recurrence based on the breast cancer index score, which means that that particular population might benefit from taking therapy longer. And so we should use a tool like this in order to understand which patients in that group might need it.
And doctor, where can we learn more?
So I've partnered with Biotheragnostics, and they have a great website. To get all this information, you can go to answersbeyond5.com.